and in addition can also control a very important process in cancer, which is inflammation. Every cancer, inflammation accompanies every cancer, and also chronic inflammation can be a causing factor for developing cancer. Here I would like to show you how this nutrients mixture, nutrient synergy, compares to a single compound in their anti-cancer activities. And in this case, we conducted a study on breast cancer, and this was a study done in rats. So at the moment where the rats developed tumors that we could identify and measure, we divided them into three groups. One group was kept on control diet, and we didn't change anything in their treatment. The second group got additional green tea extract, which is known as an anti-cancer agent. And the third group was kept on the diet, supplemented with a mixture of nutrients. As you can see, that nutrient synergy was more effective than green tea in inhibiting growth progression of those breast tumors. And in addition, it had other beneficial effects. What we could see that on the normal diet, the rats developed about 4 tumors per animal. In case of green tea, the number was 50% lower, but with synergy, we observed only 1 tumor per rat. Also, when it comes to the number of animals that did not develop any tumors, we could see that more than half of rats that were kept on synergy, nutrient synergy diet did not develop any tumors, while the rats on control diet, all of them developed tumors. And what was another important factor, another important factor was that all tumors that developed in animals that were kept on control diet were advanced tumors, as classified as grade 3 carcinoma, while none of the tumors that developed in nutrient synergy supplemented group was advanced cancer. So you can see the benefits of synergy of micronutrients versus single individual components, and of course non-treatment at all. Does this apply to people? Here I will show you just one of many examples of patients who took advantage of this knowledge. And here you can see the example of brain tumor, glioma, which developed in this patient, and after about 1 year of supplementation, this area of the brain is free of cancer. And this person is still alive and free of cancer for the last 9 years. We also have the cases of lung tumor, and the patient is free of cancer for the last 10 years, even more than this patient. And patients with more advanced cancers like metastasizing lymphoma, and breast tumors and colon cancer. So I'm sure that many of you, seeing these results, are thinking about your mothers, fathers, perhaps children. If they knew about this progress, if they knew about this research, don't you think that they would have benefited from it? Now another topic of our research, and that affects every one of us, is the effects of micronutrients on the function of our immune system. we all know, because it's common knowledge, that micronutrients are essential for optimum function of our immune system, for resistance to infection, because they help in proper optimum synthesis of white blood cells, antibodies, and other factors involved in the immunity. But not everybody knows that micronutrients can control the infective agent, whether this is bacteria or a virus. And in this case, we were studying the effects of micronutrients on development and progression of flu virus in the body. And what we know is that micronutrients can act on main stages of infection. So they can prevent the virus from infecting the cell. They are also effective in inhibiting multiplication of the virus inside the cell after infection has occurred. And also micronutrients are important in preventing viruses from spreading in the body or in the tissue, because they can affect enzymes that which dissolve this tissue and facilitate spread of viruses in the body in a similar way that cancer cell is spreading. And on the next few slides, I will show you scientific evidence supporting each of this, what I just said now. So here on this slide, you can see how nutrient synergy can inhibit the penetration of viruses inside the cell. This is the human flu virus, H1N1 type. And the synergy of micronutrient was more effective than vitamin C alone. This slide illustrates that when cells are already infected with the virus, micronutrients can help as well, because they can inhibit the multiplication of the virus inside the cell. The more micronutrients, the smaller growth of viruses. And on this slide, you can see that micronutrients can also inhibit spread of viruses in the body, because they can inhibit different types of enzymes that are needed for viruses to invade other cells and spread in the tissue. So what do these results mean? That micronutrients can control human flu viruses by affecting key stages of infection at the same time, and therefore have a very powerful effect on the virus, because they can prevent infection of the cell, they can prevent multiplication of the virus, they can also prevent viruses from spreading in the tissue. We've been today, because of a time constraint, I cannot share with you all the results of our research, but here just some other areas of immunity that we were working on. Our studies showed that in case of bird flu, micronutrients working in synergy are able to suppress viral replication and also prevent tissue damages in infected birds. The study were done on birds, and we used 10,000 birds in the study, so the results are meaningful. Also, we did a study in patients with AIDS, patients who were positive for HIV virus. And the results showed that in about 900 patients, micronutrients intake reduced all symptoms that define AIDS as a disease and other accompanying symptoms.